Hello everyone, welcome back to my YouTube channel. This is Nursing with Annie on your screen. I film about nursing, health, lifestyle and faith. If you're stumbling on this video for the first time or across this channel for the first time, you are very welcome. If you're a returning subscriber, thank you for tuning in to see what this video looks like. So without much ado, on this video, it's based on pharmacology, and I'll be talking about specific rules for drug administration, which is under pharmacology. Pharmacology is one subject that you cannot escape in nursing school. You will have to learn how to deal with drugs, you will have to learn how to administer drugs, you will have to learn how to, handle drugs and all of that, because you are going to interact with patients and doctors who will be giving prescriptions, so you have to have a knowledge of pharmacology. And on today's video, I'll be talking about specific rules for drug administration. There are not much information surrounding this. It can go either way, and the first I have is read the patient's full name from the prescription sheet. Before you administer drug, you have to read the patient's full name from the prescription sheet. That is the sheet the doctor is going to write the prescription, because it is the doctors that prescribe drugs. Your own duty as a nurse is to administer the drugs. So you will do well to read out the patient's full name, so you will not administer the drug to a wrong patient, because this has to do with human lives. The next is read the prescription, checking the validity and time of last administration. When you give a drug, before you give a drug, you have to check the validity, meaning for how long is this drug to be given. You have to check the time of the last administration. This drug, when was it administered last? Maybe a nurse in the previous shift administered the drug, so you want to know when last the nurse administered the drug and where you are to take over. Then read the name of the drug from the label. It is very important, so as not to mix up drugs. You have to read the drug from the label to know that you are giving the right drug. Check expiry date before administering a drug. Before you administer a drug, always make sure to check the expiry date, so as not to give an expired drug. It is very common, giving expired drugs. You might not know. So before you administer any drugs, do well to check the expiry date. Measure and count the correct dose. You have to measure and count the correct dose before administering a drug to the patient. Make sure you check the dosage, the amount you are to give to the patient. Then, when measuring liquids, shake the bottle, hold, measure at eye level. Okay, let me come again. When measuring liquids, so I'm going to use this marker as an example. Let's take for instance that this marker is a bottle of liquid drug, like maybe a cough syrup. First, you shake the bottle, and when shaking the bottle, you don't shake like this. No, it's very wrong. You hold the top and then the bottom, and you shake like this. You shake like this. Do you see how I'm shaking it? You shake like this. Not vigorously like this. No, just gently. You shake upside down. Then you measure at eye level. You keep the drug at eye level, the bottle at eye level, and then you measure. Then you pour out from the back. For example, if this is where the label is, I hope you can see. If this is where the label is on the bottle, you measure from the back. You pour out the liquid from the back, not from the front like this, in order not to stain the label, or how would I put it? In order not to stain the label, you pour from the back like this. You pour like this and not like this, because when you pour like this, there's every chance that the liquid might spill on the label, and then it will deface the label of the drug. You might not be able to see the name of the drug again. So you pour from the back of the drug, or the bottle of the drug, so as to keep the label clean. Then we check the label before returning. Before you return the drug, you check the label again to still make sure that you are administering the correct drug. You still check the name, check everything about the drug to ensure that you are giving the right drug. Reconfirm patient's identity before you give this patient the drug. Finally, reconfirm the patient's identity, make sure you call the patient. If the patient is not conscious or maybe the patient is sleeping, you call the patient and make sure a relative of the patient answers you. Yeah. Ensure patient is in a fit state to receive the drug. Make sure the patient you are going to administer this drug to is in a fit state. Make sure the patient is not asleep. You can't give drugs to a patient who is asleep, especially when it comes to tablets and liquid. It can be an exception for IV infusions and drugs that go through the veins. But when it has to do with oral drugs or liquid drugs, you have to ensure that the patient is in a fit state to give the drug. At least if the patient is lying down, you can tilt the head forward and raise up the patient a little bit so as to ensure that the patient does not choke while taking the drug. Finally, give the dose and ensure it has been swallowed. Most times patients can be tricky. When you give them drugs, especially tablets, they put the tablet under their pillow and tell us they've taken the drug, and you as a nurse, you will feel the patient has taken the drug and you go about your other activities, and then the patient is in the patient's mind, the patient has tricked you, and the patient will be like, this nurse doesn't even know anything, she doesn't know how to put the drug under the pillow. So you make sure that you are there, the patient receives the drugs and take the drug. You have to watch the patient take the drug, and then you must also ensure if it's a drug that should be taken after eating, you should ensure that the patient must have eaten before administering the drug. So these are basically the specific rules for drug administration. It is important that you know them as a nurse. You will come across them in exams, you will come across them in your practical exams where you'll be asked to administer drugs, and these are the rules you should follow when administering drugs. So I've come to the end of this video. You can drop your comments if you're not clear on any in the comment section. I'll be looking forward to read them and reply. Yeah, so thank you for watching up to this time. If you've not subscribed to this channel, why are you missing out on great value? Why are you missing out? Subscribe to this channel, like if you watch to the end and you enjoyed the video, give it a thumbs up, share this video for someone who will find it very useful and important. Yeah, subscribe if you're not. I'll be dishing out tutorials, nursing tutorials on different topics and subjects on this channel, so do well to subscribe, turn on your notification bells to know when I post a new video. And until I see you again, I still remain nursing with Annie. Bye.